When will every American, if they want to test for their own peace of mind, when will that be available to anybody who wants it? And I know the president, by the way, did get the co-pays removed from the insurance companies when he met with them. That's a big deal in my mind. When will it be available to everybody who wants it, any place, anytime?
So he did get those co-pays removed on those tests. It's getting better and better every day. We're getting the private sector involved, and that's going to make it a more seamless experience. We're already seeing in Washington, Colorado, and Minnesota, and now in New Rochelle, New York, drive-through sampling so that you can get sampled, the test will get sent away, and you'll get those results. So we're making it a more seamless experience each and every day.
How concerned are you that when these numbers do start to rise, which Dr. Fauci has told us to expect, that there'll be enough ICU units, enough ventilators to help the people who do get sick in this country?
Well, that's why we have an emergency prepared system. You know, we're used to dealing with disasters. If we look at some of the disasters that have happened around hurricanes in Puerto Rico and Florida, there is a system in place to make sure that folks that are on the front lines have the equipment and the supplies that they need.
So are you saying that we
one
do
of the
have
things
enough?
that we're doing at CMS is to have rapid dialogue with healthcare providers.
I understand
the other thing that we've really focused on
can I just ask you one more time? Will there be
making
enough?
Sure that people understand, hey, before you go into your doctor's office, you can call your doctor on the phone and have a discussion with them, and they can tell you whether you need to come in or not. And that's really important because we don't want to have people have to travel unnecessarily if they're not feeling well.
I want to ask you one more time. Are there going to be people in this country who don't get a ventilator if they need one? Are you concerned that the actual physical equipment that is needed to serve the people who will get sick is out there? Can you reassure everyone tonight that there is not a shortage of ventilators or ICU units?
And that's why the president has taken such a bold and decisive action, right? We're not waiting for this to get worse. We're not waiting for this to be a crisis in our healthcare systems. And that's why the mitigation strategies that he announced last night, limiting travel from Europe, not allowing that. You know, we've given travel advisories on cruise ships. That's why we're taking all of this action, because we don't want to put stress on the healthcare system.
Okay, that's not a direct answer to the question, but it sounds like a hope that there won't be enough sick people and we won't run out of ventilators because we have mitigated, and we certainly hope that that's the case.
Whoa!
Wow!
President Trump.
Well, hold on. First of all, Martha MacCallum went back at her
3 times.
3 times. And she talked about, the answer was, instead of ventilators, she talked about rapid dialogue. We're going to have rapid dialogue.
Nobody knows.
And Willie, the head of HHS was asked a very direct question. Sean Hannity asked a question that, following up what the president said, if you want to test, you can get a test. So Sean Hannity asked a question. I think the most important question, actually, that Americans want to know right now. If I want to test for my parents, if I want to test for my grandparents, if I want to test for my child, for my boy or girl that have an underlying health condition, can I get it? Azar didn't answer. What did he say? He said, we're going to try to make it, quote, a more seamless experience. This is why the markets are freaking out. This is why the markets have lost the majority of what they gained under Donald Trump as president. These questions have to be answered on ventilators, on hospital beds. The CDC, Willie, reporting in the New York Times, said up to 21 million people in America could be hospitalized because of this pandemic. 21 million people. We have 925,000 hospital beds in this country. That means over 20 million Americans could be without hospital beds. We need answers, and none of the president's men or women are giving answers, not to, quote, fake media, but to hosts on Fox News.
To Sean Hannity, of all people. To Sean Hannity. He's asking a good question there, and he didn't get an answer. The reason you see tap dancing from White House officials and people working on this around Donald Trump is there is no good answer. The answer to the question is, if someone's sick, can they get a test, is a resounding no right now. Absolutely not. You cannot get a test if you don't feel well. In fact, people are being told, go home and isolate yourself. That's the best we can do right now.
Like I said before, I have a friend.
Isolate. Okay.
I have a friend who went in, couldn't get the test. I said, go home.
Yeah.
Just go home. But Willie, so here's the thing. All right, everybody screws up. Everybody makes mistakes. Every president makes mistakes. Every administration is asleep at the switch from time to time. All right. So okay, you screwed up. We get it. Even Sean Hannity said last night the White House screwed up on testing. Okay, great. So what are you doing now to assure Americans, to make sure that we can actually see who's sick, so the mathematicians, like they're doing in Italy, can actually game this out to figure out how to stop 21 million Americans from being hospitalized with a pandemic, and to make things better? What are they doing now? We're getting no answers from the people in charge.
And did you notice a tick in the official who was talking to Martha MacCallum when Martha asked for the third and fourth time for a direct answer about ventilators and physical equipment? She said, well, the president has taken bold action, like the travel ban yesterday. They reflexively go to, I better praise the president of the United States because that's my first job here, and make people think everything's okay. When that is the initiative you're sent out there with, to protect the president and create the appearance that things are fine, that is not what you want in crisis management.
And Joe, take a guess.
You know, they're talking, Mike. That answer, Mike, was from last week, by the way.
Oh, my
Somebody should tell her that even the president of the United States is now admitting this is a pandemic and we need to move forward. That's not an answer anymore, even inside of the White House.
But take a guess as to why they all have basically the same answer as Seema Varon just had, repeatedly ducking the question 3 times from Martha MacCallum. It's because they know that the President of the United States is spending his days and nights watching them on Fox, getting ready to criticize their performance, and tweeting about past errors the CDC did not make, but accusing the CDC of having made errors in the past that got us into the situation we're in now, blaming the Obama administration for where this country is in right now. That's where we are as a nation.
This information threatens his presidency. It is easy math when you look at the patterns of President Trump.
Well, and in this case, as Jonathan Lemire wrote a couple of days ago, viruses can't be bullied. Pandemics do not collapse at the sight of a unified Republican Senate. It is facts. The president has to deal in facts. I am hopeful that he's moving in that direction. I'm hopeful that other members of his administration are moving in that direction. They certainly recognize now that this is not a media hoax, that this is a pandemic. That is a big step forward. So at least we can all have the same conversation about the 21 million Americans and the senior citizens from Florida to Arizona who are endangered because of this. But Gene Robinson, you're writing about what the markets are obsessing about. And guess what? It's not profit. It's not corporate profits. The markets are obsessing about the testing. They're obsessing about not knowing how big. It's like Stephanie Ruhle said earlier this morning. If you talk to the most powerful CEOs in America, they're not talking about financial situation. They're saying, we don't know how big this is going to get, so we can't project out what the next quarter looks like, what the next 2 quarters look like, what the next 3 quarters look like. So they're making decisions that are going to damage the economy because they're flying blind, because there are no tests out there right now. That Americans can't get the tests that they need them. Azar wouldn't even answer Sean Hannity last night. So do you have any information? When can Americans get a test if they want a test?
Well, not now, and who knows when. I mean, this is this is the base. This is where the problem starts. I mean, obviously this administration didn't create this virus, didn't create this problem, but it begins with the testing. We have to know how widespread it is, where clusters are, who has it. Tom Hanks is in Australia right now, receiving in isolation, receiving treatment. He and Rita Wilson, because he happened to be in Australia when he fell ill, and it was easily tested. It was it quickly found out that he had the coronavirus, and he's being tested. Had he developed a cough or whatever it was here in the United States, he would still have no idea. And the people he's in contact with would have no idea that he has the coronavirus, because we aren't doing the testing. It's shocking to me that the CDC dropped the ball here. The administration has completely botched it, and so here we are. We're still waiting for the tests. And to Martha McCallum's question about will we have enough ventilators? Do we have enough ICU beds in a worst case scenario? The answer is no. I mean, the very clear answer is no, we don't. No country does. That was the problem in China initially. That's the problem in Italy, which has a first world healthcare system right now, and it would be the problem in the United States if we don't really take seriously this campaign of social distancing, if we don't bend this, flatten this curve of new cases, that's what we're about here. We need a much better narrator for this crisis. We need somebody to kind of explain where we are and where we're going and why we're going there, and what the consequences are if we don't go there. And we have and we have Donald Trump. We have an egomaniacal, solipsistic, reality TV star who is up in the White House residence this morning tweeting about the Obama administration. Right. Give me a break.
Yeah, I will say, Willie, we do have Dr. Fauci, and it's just like our previous guest this morning said, they can't listen to what a lot of people say inside the White House. But Dr. Fauci, obviously, it's been great hearing his testimony before Congress, because he's been straightforward. He's been telling the truth. I actually have just heard over the past 5 minutes from inside the White House that they expect announcements on testing today, expect to make some progress on testing today. So we can only wait, watch, and hope.
Yeah, I guess the question is, how did we get here? Well, we're now in the middle of this crisis trying to race out these tests. And we'll hear from Dr. Fauci in just a couple of minutes. He'll be with us live. We've also been talking a lot about how American life has ground to a halt during this outbreak. The sports world, the most stark example, perhaps. The back cover of this morning's New York Post reads, March 12th, 2020, the day the sports world stopped. Beginning on Wednesday night with the NBA, and then all across yesterday, the sports world was forced to adjust to the realities of the global coronavirus outbreak. The NBA season was suspended after the Utah Jazz All-Star Rudy Gobert tested positive for the virus. And then, like dominoes, league after league began to fall. The NHL season was suspended indefinitely yesterday afternoon, noting it shared many of the same venues with the NBA. March Madness was next, with the NCAA canceling both the men's and women's basketball tournaments. This shortly after the Power 5 leagues canceled their own conference tournaments, with the Big East pulling the plug at halftime of St. John's matchup with Creighton at Madison Square Garden. The PGA Tour shut down, as did the men's and women's pro tennis tours. Major League Soccer suspended its season for 30 days. As European soccer leagues, from the Premier League to the Champions League, postponed their seasons just this morning. And Major League Baseball canceled its spring training schedule and pushed opening day back by at least 2 weeks. Joining us now, best-selling author and columnist Mike Lupica. Mike, good to see you this morning. We've been talking already today about the void we feel from sports missing in our lives. You turn on the TV, you need a break from the politics and everything else going on in the world, and it's missing. The NBA, though, as it has on so many issues, took the lead 2 nights ago and sort of set this in motion.
You know, Adam Silver, the commissioner of the NBA, figured out something, Willie, and we see it now with the federal government. If you don't get ahead of your own narrative, it will run you over. And if this goes with everything you all have been talking about this morning, how did further disaster get averted in the NBA? Because Rudy Gobert got tested. They had tests available, and they found out that he had tested positive for the coronavirus. And it was ironic that it was Gobert who has now apologized for being so frivolous about this, because he seemed to have bought into the meathead theory that we see from the bullhorn media that, you know, that this was something trivial. Well, it turned out to be not something trivial, and Silver got out ahead of it, and you're right. Then all of the dominoes began to fall. And Willie, here's the other thing. I always thought it was counterintuitive from the start that empty arenas were somehow going to mitigate this problem, as though only the people in the stands might transmit it. Well, that all changed when they found out about Rudy Gobert and then one of his teammates, Donovan Mitchell.
You know, Mike, you've been in and out of ballparks and stadiums for most of your life, and the impact that this is going to have, the economic impact is going to have on people who work at these stadiums, who make their living at these stadiums, not the athletes. Major League Baseball ostensibly plays a 162-game schedule, an everyday schedule, and nobody knows, or nobody seems to know, what's going to happen with that schedule given the ethereal nature of the virus, where it's going, how long it's going to be with us. But think of the people, and talk about the people who you know, who work at these stadiums, who are now going to be without a living.
Yeah, I mean, Mike, we know when we talk about sports, we know that it is a non-essential part of our lives that feels extremely important. I saw today that Kevin Love of the Cleveland Cavaliers had contributed $100,000 to arena workers. And those are the people who are going to suffer. Yes, spring training is going to disperse now. Everybody's going to go home. At some point, the baseball season will start. I'm not sure we're going to see NBA basketball until the playoffs, but it's those people, vendors and ticket takers, all of those people this is a different kind of at-risk situation for them because it's financial risk.
Yeah. Well, you know, you're in a place right now, Mike, down in West Palm. You're in a place where economies depend all across South Florida and Central Florida. A lot of these towns depend on, you know, the 30 days that spring training takes place, because tourists flood in from across America. They come down, and their entire business model is built on the money that they make over 30 days in spring training. This is actually a great microcosm for the economic pain and I believe the possible recession that'll be coming this next quarter. Because of the coronavirus. This is going to be absolutely devastating for communities around these parks that have built themselves up over the past 30, 40 years based on 1 month of baseball tourism.
Joe, it's every year you see it. I was at the first day of spring training games this year in Jupiter, and standing out in the concourse when they played the national anthem, looking at a full ballpark and thinking it's like the Magic Kingdom in Florida and Arizona every year. You know, it's like the circus comes to town for a month and then it leaves, but it is an essential part of the economy of these two states. And again, it's to watch baseball shut down. The only equivalency I can come up with, and it only lasted a week, was after September 11th, when sports shut down then, and basically until Mike Piazza hit a home run one Friday night at Shea Stadium. But this is going to be much longer than that, and all of these deadlines that we hear are completely arbitrary. 2 weeks, 3 weeks, a month. Sports has become one more capital of what my dear friend William Goldman said. Nobody knows anything, and we're all just speculating at this point.
All right. Thanks so much, Mike Lupica. We appreciate it. Speculating also continues when it comes to the political world. John Heilman, we were going to have a debate with an audience in Phoenix. Then the audience got removed. Now the debate is going to be in Washington, D.C., I think in CNN headquarters. Correct me if I'm wrong.
Yep.
The bigger problem, I would guess, would be for a candidate like Bernie Sanders, who is so fueled by crowd sizes, so fueled by that energy and those huge, massive rallies he has across America, that now a quietness has settled over both campaigns, and things are a bit surreal. How is it changing the dynamics when you're talking to both campaigns, the Biden campaign as well as the Sanders campaign?
Well, you know, Joe, they've both been off the trail now since Tuesday. Sanders and Biden, they both, shut down their events on Tuesday, went back home basically, or back to their headquarters on Tuesday night, and there's nothing really planned going forward, which is, of course, totally unusual. It's the second time now in this 2020 campaign where an external event has kind of knocked the campaign off of its normal axis, first with impeachment back in January, and now this obviously a global deal. But you've got, I think, Bernie Sanders, who already, I think, sees the writing on the wall in terms of the delegate math, already understands that he has lost, essentially, the Democratic nomination, is going to have this debate on Sunday night, but recognizes that, not only is the math against him, but this dynamic on two levels, a practical level, which is if you were going to try to wage a war and fight this out and try to you need a kind of a miracle for Sanders. And if he's going to do that, the only way you can start to generate that would be through having to win big upset landslides in state after state. For a candidate like Bernie Sanders, the way he'd do that would be by generating his grassroots campaign, that energy, going and having these big rallies from state to state, and he's not going to be able to do that. And then on top of that, I think you've got the other thing, which is that the appetite in the party, it's already been clear these last two Tuesdays, the rallying behind Joe Biden, the desire on the part of large parts of the party to shut this thing down, to coalesce behind Joe Biden. That is what the voters have spoken in these last two Tuesdays. There's no reason to think they're not going to continue speaking in the same way. And that's about a desire to move forward for the Democratic Party to get behind its nominee and start to move to the general election, move to taking on Donald Trump. And this global pandemic and the domestic elements of it, Donald Trump's failures of leadership that are on display that you guys have been talking about all morning, that we've been talking about for days, it increases the urgency in the party to start to, if the party is with Joe Biden, let's get to it. Let's move on to this point, get behind Joe Biden and start to focus on this guy in the White House. I think the pandemic on those two levels, practical and political, are making it essentially impossible for Bernie Sanders to continue much beyond this debate on Sunday and maybe the contest this Tuesday. I would imagine we're probably going to see this race wrap up if the Tuesday contests go the way that we think they're going to go, which is really very much in Joe Biden's direction.
Yeah, Elise, the dynamics were breaking against Bernie Sanders over the last couple of weeks, starting in South Carolina, then Super Tuesday, then the elections this past Tuesday in Michigan and the other states, Mississippi and the other states. But, as you know, when you're in a campaign like that, you need to dramatically change the dynamics. And when the campaign is frozen by an outward event like this pandemic, that's next to impossible for Bernie Sanders. So as John said, his difficult situation is made almost impossible now by the developments, outside developments over the past few weeks.
It reminds me of 2008 when John McCain needed a reset and the financial crisis took over everything, and his response did not engender him necessarily any momentum, any bump in September at a time when he needed it. And so I agree with Hallman. I don't see how Bernie Sanders gets the reset that he needs. It would be just absolutely incredible if he could manage some kind of extreme turnaround and just start sweeping state after state after state after getting shut out in counties in Michigan and Mississippi, where you see Biden's total dominance at this point in the race. And this pandemic doesn't seem to be slowing. If anything, what we've seen from the trend lines in Italy and other countries, the next 2 weeks are going to be pretty momentous in terms of how the future is going to look with coronavirus containment. And Bernie Sanders really is going to probably get overshadowed by the pressing pandemic that the country's grappling with, and the world too.
Yeah, you know, Mika, it's interesting also, we saw Jeff Weaver on being interviewed. Right. And he just said matter-of-factly that if Joe Biden wins a nomination, Bernie Sanders is going to endorse him and is going to be working hard to get him elected. I think Donald Trump's disastrous initial response to the coronavirus has shown how critical it is that Democrats come together and do what they can to defeat Donald Trump. I think it's just changed the dynamics of this entire race. And again, it's been really unfortunate for Bernie and the campaign politically, just because it has frozen things in place when Joe Biden had extraordinary momentum. He still does.
All right. Well, up next, we're working on getting Dr. Anthony Fauci. We're going to have an interview with him and just get the latest on where we stand with the coronavirus outbreak and the possibility of mass testing. We'll be right back. We are joined now by the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. Thank you very much for joining us this morning.
Doctor, thank you so much for being here today. And we really, most importantly, we want to thank you on behalf of our family and loved ones and seniors across America. We want to thank you for the service you're providing to America. It means a lot to all of us.
Thank you. Thank you.
So where are we right now? We obviously have stumbled. We could all talk about what we haven't done over the past month. Let's talk about where we are right now and what you think the next few weeks are going to look like for most Americans.
Well, with regard to the virus itself, the next few weeks for most Americans is obviously what you're going to see is an acceleration of cases. There's no doubt about it, because that's how these outbreaks work. When you look at the historical perspective of these types of outbreaks, they go along like this, then they start to come up, and then they take a big spike, they peak, and they come down if you don't do anything. If you try and interfere either by preventing influx of cases from the outside, like with travel bans, which we're doing, as well as containment and mitigation, the kinds of things of physical separation of people, what you hope to do is to get that peak become a little bit of a hump. Now, that hump's going to be still a lot of people are going to get infected and a lot of people are going to get sick, but hopefully it will be much, much less than the major peak. So two things we're looking for. A, things are going to get worse before they get better. But B, what's happening now with many more tests that are going to be going out very, very shortly, with people now very seriously taking containment and mitigation into effect, hopefully we'll be able to blunt that peak. That's what I see in the next few weeks.
Let's talk about the tests in a moment, but first, obviously, I want to talk about your testimony. It made a big difference with the NBA, and I think every other sports organization deciding to shut down for a while. I've read reports that actually closing down schools, which the French just did yesterday, K through 12 in the colleges, acts almost like a firewall against massive spreading of these pandemics. Do you agree with that? And would you recommend, whenever possible, schools, K through 12, colleges, community colleges, shut down for the next 3 weeks or so?
I think you need to do it proportionately. If you have a considerable amount or even the beginnings of community spread in your community, clearly you need to do very aggressive mitigation procedures. If you have less, you can start doing something. I mean, physical separation, a lot of crowds, don't do unnecessary travel, the kinds of things like telework, that's all fine. When it comes to the really, really forceful mitigation, should be a little bit more proportionate. But with regard to what you're saying, what the effect is, even though we know, because we have experience now with other countries, that children, although they get infected, they really, unlike influenza, they do not necessarily at all get serious disease. In fact, if you look at the history of what we've seen, children do very well. The only problem is when they get infected, and schools can be a breeding ground for that, they go home and infect grandma, grandpa, or a relative or someone who might be in a more vulnerable position. So that's the rationale for shutting schools.
Yeah, so let's move on to the testing question. Obviously not your domain. You expressed the concern that a lot of Americans have expressed, that we have failed as a country over the past month to move forward as quickly as possible. Do you have any information about when Americans will be able to walk into their doctor's office and get a test if they need a test?
Yeah, the way things are going right now, looking forward, there's been a major push to embrace the private sector. And that's something that you absolutely need to do when you want a much broader capability of testing. Right now, the FDA, Secretary Azar, the CDC, all of us together have been now pushing with the task force so that within, and I would say, you know, it's dangerous to give times, but I would think within a week, we're going to start seeing a real acceleration of testing. And then as we go 2-3 more weeks, it'll be much, much more. So I think we're going to see a much different situation than we saw just a few weeks ago.
So obviously for organizations, Dr. Fauci, across the country, schools, et cetera, it's hard to make decisions without testing, without information. So they're sort of flying blind. So then that leads to the question of self-quarantining. How important, you hear of some people making the decision to isolate for 2 weeks. How important is it to self-quarantine if you think you may have been exposed?
Well, I mean, obviously, if you feel that you're exposed, first of all, if you get sick and feel sick, you should stay at home. Make a phone call to your healthcare provider, to the clinic, to the emergency room. Explain to them that you are feeling badly and figure out a way how to safely get tested. The idea of someone in an area of the country that is not having community spread to all of a sudden now start really self-quarantine, that's a bit much. What you should do is try and physically separate yourself from unnecessary interaction with large crowds. Unnecessary travel, particularly, and I want to underscore, particularly if you are an individual who falls into the vulnerable category, the elderly or individuals with underlying conditions, chronic congestive heart failure, heart disease, diabetes, et cetera, et cetera. The most vulnerable need to be much more serious in separating themselves from the general public.
And I appreciate that. So that answer was for people who are feeling symptoms, any types. But what about if you feel you've been exposed to somebody who has coronavirus, who has tested positive? Is it important, is it mandatory that you self-quarantine?
Well, if you feel you've been exposed, you should, first of all, try to get tested. That's for sure. But you should immediately, in lieu of getting tested, like within the next few minutes, you should try as best as you can to self-isolate yourself.
Dr. Fauci, it's Willie Geist. We appreciate you taking some time with us this morning. Just to piggyback on what Mika said, we know the President of the United States over the weekend at Mar-a-Lago himself was standing with and had physical contact with someone from Brazil who now has been diagnosed with coronavirus. Should the President himself be tested for coronavirus?
You know, I leave that to the president's physician. They have a very good White House physician and physician staff there. So when you have a situation of a patient-doctor relationship, the advice for that should come from the White House physician.
But generally speaking, if I were standing next to someone who had been diagnosed with coronavirus, should I isolate myself and find a test as well?
Yes.
Okay, so that goes for the president, likely, in theory at least? But you'll leave it to his doctor?
I'm going to leave it to his physician, who's a very good physician.
Okay, Dr. Fauci, the president said yesterday that there were 1 million coronavirus tests out there, with 4 million, he said, coming in the next few days. Is that an accurate number?
The number of what's out there is accurate. The difficulty was the connection between the people and the process, and connecting them with actually implementing the test was the reason why people, as you know, are calling in saying, I tried to get a test and I couldn't get it. Hopefully that's behind us. But looking forward, as I mentioned just a moment ago, we should start seeing an escalation of capability of getting tested.
Well, that's the disconnect a lot of people in this country, I think, see when they hear you say that. Okay, there are 1 million tests out there, and yet for most people, New York City, any other city they want, if they go in and say, I need to be tested for coronavirus, they're told, we just don't have them. You got to go home and isolate yourself and take an ibuprofen and drink fluid. So where is the disconnect, and why isn't it being connected?
Well, it is being connected now. There was a disconnect there for sure. We have to admit that. It's unfortunate, but it's going in the right direction right now. No denying there was a bit of a disconnect where people hear that a test could be available to anybody, and they go into a doctor's office and they didn't get it. That's unfortunate, but what we're looking now is looking forward. And hopefully in the next few days to a week or so, it's going to be a major escalation.
So what's changing, Dr. Fauci? What gives you that confidence that it is now changing, that a week from now, anyone who walks into a hospital or goes to see a doctor can get a test for coronavirus?
I'm not saying that anyone and everyone, I'm saying it's going to be markedly improved. And what has changed is that there's been a major involvement of the private sector. The companies that generally do these kinds of tests for a living are now going to be major league involved in getting this available to the public, whereas before it was mostly on the burden of the CDC as a public health organization. There's a lot of commercial issues out there that can be involved, and that's the thing that's going to change. It's getting the private sector involved.
So, Dr. Fauci, let's move to another area. And again, these are a couple of areas that obviously I think will help us be more prepared for the next pandemic. And we've talked about testing. Let's talk about ventilators. Obviously, I'm sure you're concerned. We see what's going on in Italy right now. CDC, New York Times reporting said we could have anywhere from 2.5 to 21 million people in hospitals. We only have 950,000 hospital beds, and obviously a massive shortage of ventilators to take care of a pandemic. What should we be doing to not only alleviate whatever suffering we can in this pandemic, but to prepare for the next pandemic?
You know, we have a pandemic preparedness plan that was put into effect back when we had the concern about the bird flu, the H5N1. You might remember that. It was put into effect, and it made us much better prepared. We have things in the Strategic National Stockpile. Many of the elements that you just mentioned are there. So right now, if you compare to where we were 20 years ago, we're much better prepared. But when you have something that potentially can be a really dramatic type of pandemic, the way they're seeing in Italy right now, systems could be overrun. So when we get through this, and we will get through this, we've got to go back and say, you know, we've been talking about this happening. We've got to be making sure that we never, ever let the Strategic National Stockpile get underfunded. We've got to do that. We have a lot of stuff in the Strategic National Stockpile, more than people realize, but even that can get overwhelmed when you have a major outbreak.
You know, we look at these countries across the globe. They give us a good warning about what may be coming our way. You've talked about Italy. Are we following the path of Italy right now, or South Korea, China? Based on what you've seen, based on the numbers, I mean, we've seen people follow the lines up, say that it looks like we're following the path that Italy has taken, unfortunately, over the past month. Any idea, based on science, which direction we're heading?
Well, yeah, exactly. If you do nothing and you wait too long to institute aggressive containment, mitigation, and preventing from outside sources coming in, the way we did with China and that we're now doing with Europe, that's critical. What happened with Italy, unfortunately, and I say that with great pain because I have so many friends and colleagues who are over there right now, people that I've trained myself. What happens is that they did not prevent the influx of cases. So before they could even get started, their peak was up here. When you approach the peak up here, it's much, much more difficult to get it to come down. If you're going like this, and you know if you leave it alone, it will peak. If you start right here to do aggressive measures, you may, instead of making that peak do that, you get a little bit of a hump. Now, that hump's still going to be a lot of people getting infected, sick, and maybe even dying, but much less than what Italy is going through now. So what I'm saying is that we're trying to avoid...
Have we started early enough our aggressive containment strategy? Has it started early enough to avoid that peak that Italy is experiencing?
As I mentioned, there are two components of that. There's preventing from without to in, and there's what you do mitigation in. Clearly, early on, we made a travel ban with regard to China. That was a very smart move right there, because what that did was prevent a major influx from China. Today, the new China is Europe, because Europe now is the major element, the major geographic component that is now seeding other countries throughout the world. And that's the reason why we made the very difficult but appropriate decision to have a travel ban on the European countries. So we are definitely ahead of the curve on that. What we've got to continue to do is within now the kind of mitigations that you're hearing about. Separation physically from large crowds, where appropriate, closing schools, teleworking, and things like that.
All right, great advice. Dr. Fauci, thank you. And
Thank
again,
you.
thank you for the service to this country. We all greatly appreciate it.
Very much.
Thank you. Thank you very much.
So, Willie Geist, thoughts?
Well, I think Dr. Fauci is the person who should be out there every day talking about this. He's knowledgeable, he's experienced, he speaks in facts. He should be the face of this crisis and the person handling it, not someone who's protecting his own political hide with every answer and tweet he gives. Mike Barnicle, some encouraging news there about testing in a week or so is not a solution or the end of something. That's just identifying the scope of the problem, and from there, you attack the problem.
You know, Dr. Fauci has been at this for 50 years.
Yeah.
50 years he's been serving this nation. And I have to tell you, when he speaks, he's telling you the truth.
Yep.
Very direct, very informative, as opposed to what you get out of the White House. Unfortunately, you want to tell the President of the United States to stop lying about this. And my own personal reaction when I hear Anthony Fauci speak to this issue is I fear that he might get fired for telling the truth.
Absolutely.
Because
That's exactly what I worry
working within
about.
an administration, John, that, you know, it could happen.
I literally this morning on the way in here, I was thinking exactly the same thing. It's like, we're going to be interviewing Anthony Fauci. That's a guy who is a classic person in the Trump administration with a target on his back. There's any moment Donald Trump, as you said, Mike, watching TV all day long, given that he is now, according to the New York Times, a bystander of the administration, watching TV all day long and looking for people like that, hearing us praise that person. He's the guy who Donald Trump, if history holds, it's the guy who Donald Trump turns to and tries to get rid of.
Well, but Elise, history has changed, hasn't it, over the past several weeks? About 80% of the president's gains in the stock market since he became president of the United States have been wiped out. The president and the people around him understand that they need Dr. Fauci out there, because what he does is, yes, he may say some things that contradict the president from time to time, but voices like that calm the financial markets. Voices like that make people who are deciding whether the market's going to go up 2,000 points or down 2,000 points, it makes them believe, okay, maybe we're starting to treat this pandemic with the seriousness that it requires.
Joe, I pray that Donald Trump understands that. I hope that he understands that there would be such a huge public outcry if he did try to fire a career servant like Dr. Fauci, who is trying to save lives and is calming the public by giving factual information, by not stoking fear, but giving an honest assessment, a straightforward assessment of the lay of the land when it comes to combating this coronavirus. I personally feel comforted whenever Dr. Fauci is going through step by step what the administration is doing and is addressing honestly the shortcomings to date and how they are remedying to fix and to make it better going forward and to help stop and lessen the brunt of this virus.
Hey, Gene Robinson, what are your thoughts about Dr. Fauci and what he said today?
Well, you know, I said earlier that we needed a narrator for this crisis, someone to tell us where we are, where we're going, what could happen, what we want to happen. Dr. Fauci is that narrator. He as Willie said, he should be out there every day, telling us where we are as we change our lives in response to this pandemic. I also detected, you know, frankly, the worry in his voice. I mean, this is a serious situation, and listening to him, I just encourage everyone to take it seriously, not to panic, but to take it seriously. We have a chance to mitigate this crisis. We have a chance to make it not a catastrophe like we've seen in China and Italy, but we have to take that chance, and we basically get one shot at it, avoiding that peak that he kept talking about, that peak that overwhelms the healthcare system and leads to many deaths.
Well, and I would say I don't want to sound too glib here, but we, of course, are looking to our leaders, looking to the President of the United States and those around him to help guide us through this crisis, to provide the supplies and the help and whatever they can provide. That's critically important. It's also critically important every day, Mika, that we do our part, that whenever possible, that we do socially separate. Whenever possible, we keep a distance from other people. We wash our hands repeatedly. We don't move our hands to our face unless we've washed our hands with antibacterial soap. We've got to make sure our soap of any kind. We also, we need to make sure we cover our mouths when we sneeze or when we cough. There are a lot of really small things we need to do, and we're starting to see, and I'm very glad to see this, Mika, they're local leaders.
Yeah.
There are leaders of sports, commissioners of sports, that are starting to make some tough decisions. Local schools are starting to make tough decisions because here's the deal. Yes, our children, thank God, unless they have underlying issues, our children are not as susceptible to this pandemic as the elderly are. But if a child comes back from school and he's carrying the virus, as Dr. Fauci said, if he comes across somebody whose resistance is down, if he comes across a senior citizen, if he comes across or she comes across her grandmother, her grandfather, that puts the elderly in danger, seniors in danger, people with underlying conditions in danger. We have a responsibility ourselves also over the coming months to do what we can to minimize the spread of this coronavirus. And I think he asked a really good question, Willie asked a really good question about the president himself. Does he lead by example?
He doesn't appear to be. I mean, he was exposed to someone who was diagnosed with the coronavirus, stood next to him, took a picture with him. Now, even we know from time that we spent with him long ago, he definitely uses Purell and has lots of people. But he was exposed. And now he is working with many people who are in the age group that is at risk of really suffering from the coronavirus, of actually being hit hard by it. And people model their behavior after their leaders. And it is at this point a legitimate question as to why the president has been exposed and some of his advisors have been exposed to people, and some of them are choosing to continue to expose themselves to other people.
Well, his chief of staff, incoming chief of staff, self-quarantined. Governor,
there are some making that responsible
Senator Rick Scott
decision.
has made that decision as well. I think, actually, I'm sure the White House doctors are monitoring him at all times, and you bring up a very good point. I've actually eaten one meal with him before, and in that meal, before the start of it, he had a stack of, and this was several years ago, he had a stack, before he was president, he had a stack of wipes. And he is constantly washing his hands. He's been made fun of for being obsessive about hygiene, about being OCD about his hygiene. In this case, that's a very good thing. And more Americans actually need to follow that example in the coming weeks and months so we can try to contain this virus and not end up in a situation where you see Italy.
But still, it was direct exposure.
Right.
Now, House Speaker Nancy Pelosi and Treasury Secretary Steven Mnuchin failed to reach a deal yesterday on a sweeping aid package for Americans affected by the coronavirus, although both sides hope to come to an agreement later today. Joining us now, member of the Senate Foreign Relations and Judiciary Committees, Democratic Senator Chris Coons of Delaware. Senator Coons, do you think that there will be a package that helps the American people put together today?
Good morning, Mika. Yes, I'm optimistic that Speaker Pelosi, who continues to lead in responding to this crisis, will be able to hammer out an agreement with Treasury Secretary Mnuchin. It's regrettable that President Trump continues to nurse a grievance against Speaker Pelosi, and so he's not even spoken to her during this developing crisis. I do think that we got to see a sharp contrast in recent days between former Vice President Biden, who delivered a fact-based, science-based, transparent, enactable plan for how we should respond, and President Trump's rambling and at times inaccurate address from the Oval Office night before last. I am optimistic that we in Congress will come together in a bipartisan way and promptly pass a targeted and needed response to this developing pandemic.
Hey, Senator, it's Willie Geist. Good to see you this morning. What does a targeted response look like from your point of view as Congress gets together? And how does it help in the immediate term? We need things like tests right now. How does it, beyond injecting some fiscal stimulus and putting some money into the system, what does that do to the medical problem, the medical crisis we're facing right now?
First, we have to make it clear to any American who is sick or may be sick that we're going to make available to them paid sick leave so they stay home. Because of the president's persistent attacks on the Affordable Care Act, millions more Americans don't have health insurance today. And I've joined with other Senate Democrats in producing a bill that would ensure that all tests and treatment for COVID-19 would be free to individuals. They wouldn't pay co-pays, or they would be able to rapidly enroll in health insurance if they don't currently have it. A part of the package Speaker Pelosi is pressing that I also support, that former Vice President Biden also supports, is sick leave that allows individuals to stay home and assistance through the SNAP program that would make sure that children who only get a good meal at school are able to get food at home, because in many locations around the country, Willie, we see schools closing and children having to stay home.
Okay.
As you just heard from Dr. Fauci, the most important containment thing we can do is to cancel large public events and have people stay home. We have to make that easier, particularly for the people who will be impacted, the folks who work at arenas, the folks who work in hospitality, the folks who work in travel, the individuals we need to show compassion and support for.
Okay, Senator, so those people that you just mentioned, people who, if they stay home, they can't work because their work is not capable of being done outside of the home. What do we do about unemployment benefits for those people who lose their jobs?
We change unemployment in a way that makes it able for them to get it easily and without having to go through long administrative processes. There are a number of proposals that Speaker Pelosi put forward yesterday that would accomplish this goal. I do also think there's an openness to supporting some loan deferrals and short-term payments for small businesses that are directly impacted by coronavirus. What I don't support is the kind of across-the-board payroll tax cut that President Trump was pressing for. A payroll tax holiday from today through the end of the year would cost $800 billion that would have to be repaid to the Social Security Trust Fund, and wouldn't help people who are hourly, who are laid off, who have to go home as a result of this. So I don't think that would be an appropriate targeted relief.
All right, Senator Chris Coons, thank you very much for being on the show. Thank you for the update.